Hello, welcome to our frequently asked questions. Today I'm answering a very commonly asked question about lower blepharoplasty. Will I have pain after having lower blepharoplasty? My name is Dr. Julian De Silva and I'm a London-based facial, cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I complete for my patients on a daily basis. The information that I'm discussing with you is information that I discuss with my patients before having surgery. So in terms of lower blepharoplasty, will I have pain after the surgery? Well, generally speaking, blepharoplasty is a relatively comfortable procedure and most patients don't have a great deal of discomfort or pain. Certainly the lower eyelids can feel a little tight the first week after the surgery, but generally discomfort, well, it can be the first 24-48 hours that some patients will feel discomfort. I give every patient that I treat a prescription which includes analgesia and pain relief medicine, but I find that over 50% of patients never need to use the analgesia, and the other 50% may use one or two tablets over the first 24 to 48 hours, but after this period it doesn't tend to be that uncomfortable. Certainly of relevance to the surgery is the surgical technique that is used for your lower blepharoplasty, and I personally use a mixture of longer acting local anesthetics or numbing agents, and these numbing agents work over many hours after the surgery, meaning that many patients don't need to take analgesia. Other measures that can make a difference include using ice and cold compress. This not only will soothe the area of the lower eyelids, but it also speeds up healing by reducing swelling. And so I give all my patients written instructions on how to do cold compresses and icing to the lower eyelids in the first 3 days after surgery in order to increase comfort and reduce swelling and speed up healing. One of my patients who underwent lower eyelid surgery wrote this description of their experience. On the way home, I was feeling a little bit sore and I took 2 paracetamol tablets and fell asleep in the car. I took 2 more tablets at bedtime, but that was all the painkillers I needed throughout. And this was a patient who was particularly anxious about having blepharoplasty, and she did speak to 2 of my previous patients who'd undergone the surgery with myself and in order to reassure herself. And that is one suggestion I could make to you if you're particularly anxious about discomfort and having lower blepharoplasty. Well, it's quite reasonable for you to ask your surgeon if they could put you in touch with 1 or 2 patients of theirs who've undergone the same procedures, so that you may just let some of that anxiety pass by talking through a patient's experience firsthand. So in summary, lower blepharoplasty, well, it doesn't tend to be an uncomfortable procedure for most patients, although I completely respect that patients can feel quite anxious about this. For most patients, lower blepharoplasty is a relatively straightforward procedure where patients have a fast recovery and minimal discomfort. I hope this information has been useful for you. Thank you for watching.